Welcome to Moda Health's OEB Insurance Committee presentation for the 2022 to 2023 plan year. We are proud of our partnership with OEB and look forward to providing your members with quality health plans and assist you with any questions you may have. This year we have some exciting additions to our plan offerings. First, we will review our medical and pharmacy plans. This plan year, our medical plans will continue to use the large statewide Connexus network. And, as always, referrals will not be required for any service. Each enrolled member still has the option to participate in coordinated or non-coordinated care. To participate in coordinated care and receive the better benefits, the member must choose and use a PCP 360 for primary care services. A PCP 360 is a primary care provider who is part of a facility that has been certified by the Oregon Patient-Centered Primary Care Program or other similar programs. This means that a PCP 360 has to meet certain quality standards. Each covered family member has the flexibility to choose whether to participate in coordinated care or not. Each member will also have the option to choose their own PCP 360. To search for in-network providers, members can use Moda Health's online provider directory, Find Care. They can also call a Moda 360 Health Navigator for help finding providers and assistance with scheduling appointments. New this year, members who live outside of the Connexus service area will use Moda's new national network, with the exception of those living in Alaska, Idaho, and Texas. Members who live in Alaska, Idaho, and Texas will continue to have access to the PHCS network as they do today. We will have more details coming soon. What does it mean to participate in coordinated care and receive better benefits? By selecting a PCP 360 for primary care services, the member will receive a lower individual deductible, a lower individual out-of-pocket maximum, a lower cost for certain services like primary care office visits, specialist visits, alternative care visits, and incentive visits for chronic conditions. Members can choose a PCP 360 at any time during the year. They will receive the better benefit level the first day of the month in which they make their PCP 360 selection with Moda Health. Our medical plans include an incentive care visit with the coordinated care benefit level for chronic conditions. These conditions include asthma, heart conditions, cholesterol, high blood pressure, and diabetes. Members receive a lower copayment for visits with their PCP 360 or an in-network specialist for these chronic conditions. To find a PCP 360, the member can visit modahealth.com/OEB and follow these simple steps shown here, or call a Moda 360 Health Navigator for help. To see if a provider is a PCP 360 on our website, the member will see the 360 graphic icon under the provider's phone number. So, how do members choose a PCP 360 with Moda Health? Members can choose their PCP 360 in a couple of different ways. They can log into their member dashboard account to select their own PCP 360, or they can call a Moda 360 Health Navigator. They can also instantly chat with a Moda 360 Health Navigator through their member dashboard account. Again, each covered individual can choose their own PCP 360. However, the subscriber or employee of the plan is also able to select a PCP 360 for all covered members, including their spouse and dependents, even if they are over the age of 18. Dependents who live part-time outside of the Connexus network service area, like college students, can still choose a PCP 360 for coordinated care and receive better benefits. However, the employee will need to update their address in the MyOEB system. That way they can access Moda's new national network for in-network benefits for services away from home. Members who live in Alaska and Texas will continue to use the First Health network. When members are away and need primary care from a provider other than their designated PCP 360, they will receive benefits at the primary care office visits with a provider other than your chosen PCP 360 benefit level. Members who live full-time outside of the Connexus network service area are not eligible to participate in coordinated care. However, they do have access to Moda's new national network. New this year, members who live outside of the Connexus service area will use Moda's national network, with the exception of those living in Alaska, Idaho, and Texas. Members who live in Alaska, Idaho, and Texas will continue to have access to the PHCS network as they do today. Now, let's take a look at the Moda Health medical plans. OEB members have 7 Moda Health medical plans to choose from, plans 1 through 7. As you can see, the deductibles, copays, and out-of-pocket maximums differ by plan. The deductibles and copay coinsurances remain the same. However, new this year, the maximum cost share for medical plans 1 through 5 is being removed. This means all eligible medical expenses, including additional cost tier copay coinsurances and pharmacy expenses, will now accrue towards the out-of-pocket maximum. Once the out-of-pocket maximum has been met, all eligible medical and pharmacy services will be covered at 100%. As a result, you do not need to worry about needing to meet your two different medical maximums anymore. Now, there are a few things to note about high deductible health plans, or HDHPs, medical plans 6 and 7. High deductible health plans can be paired with a health savings account, or HSA, but members are not required to contribute to an HSA to be enrolled in plans 6 and 7. Preventive services are covered in full. All services are subject to the deductible and coinsurance. The pharmacy services are also subject to the deductible and coinsurance, with the exception of value tier drugs. This means the deductible must be met first before the plan will pay any medical or pharmacy expenses, with the exception of preventive services and value tier drugs. Please note that members covering one or more dependents must meet the family deductible first. There is no individual deductible on family plans. Also, keep in mind that the deductible and coinsurance both accrue towards the member's out-of-pocket maximum. Effective October 1st of 2022, continuous glucose monitors, or CGMs, and diabetic testing supplies will now only be covered under the pharmacy benefit and no longer covered under the DME benefit. Members can obtain these supplies through our retail pharmacies or mail-order vendors, Postal Prescription Services, and Costco for additional savings. Members who are currently receiving these services under the medical benefit will receive a communication 60 days in advance before the effective date. Any prior authorizations, or PAs, under the medical benefit will also be loaded under the pharmacy benefit to ensure there is no member disruption in coverage. Effective October 1st of 2022, Moda is also expanding our Site of Care, or SOC program, to add therapeutic oncology medications. The program redirects members receiving select infused medications from the hospital outpatient setting to clinically appropriate home infusion. The SOC expansion program will work just like the existing SOC program today. If a member cannot receive home infusion or declines home infusion, we will work with the member to find an alternative care site, such as a provider's office or alternative infusion site. Effective October 1st of 2022, we will be adding Moda's new Pre-Diabetes Prevention Program, or Pre-D. Members who engage in the Pre-D program can decrease their risk for chronic conditions such as heart disease, stroke, and developing type 2 diabetes. Moda Health lifestyle health coaches will work with members who have been identified with prediabetes to teach them about healthier habits that can lower their risk for diabetes. We will reach out to see if they would like to participate in a personal wellness program that's right for them. Lifestyle coaches trained in diabetes management will guide members using standards set by the CDC. Health coaches are also available to assess how the member is doing, help set personal goals, refer them to a nutritionist, and have quarterly check-ins to assess their progress. Members who participate in the program will receive a Fitbit to help them track their weight and exercise. We will also be adding Moda's new behavioral health program. The program will provide dedicated behavioral health champions to help members get the best treatment that meets their specific health needs. They will identify the most appropriate treatment options and determine the support tools that are needed. They can also help members find available providers, assist in scheduling appointments, and make sure members can access their treatment and confirm that the treatment is meeting their needs. The program will also expand access to additional providers through digital point solutions. We will have more details coming soon. Here you will find an overview of the pharmacy benefits. Plans 1 through 5 are traditional in design. There are no changes to the pharmacy benefit for the 2022-23 plan year. Members will pay $4 for value tier drugs and $12 for select generic drugs. For a preferred brand, they'll pay 25% coinsurance up to $75 max. For non-preferred brands, they'll pay 50% coinsurance up to $175 max. For specialty, they'll pay 25% up to $200 max. For non-preferred specialty, they'll pay 50% up to $500 max. The prescription benefit works a little differently with the high-deductible health plans 6 and 7. Pharmacy expenses accrue towards the plan deductible. Once the deductible is met, Moda Health will pay 75% or 80%. This will leave a 25% or 20% cost share for OEB members, depending on whether the member has chosen the coordinated care benefit level or not. On both of these plans, the deductible is still waived for value tier medications. All OEB medical members have access to our Moda 360 program. Moda 360 is an exciting program that is transforming the way we support our members. The Moda 360 Health Navigator team helps the members navigate the sometimes complex healthcare system. The Health Navigator team connects members to programs and resources that are best for them. They will work directly with the provider to take the member out of the middle. Every time a member calls the Moda Health OEB member phone number, they will be connected to a Moda 360 Health Navigator. The Health Navigator will not only answer any questions they may have, but will also serve as a guide to connect members with the care, resources, and programs that work best for them and their families. They can also help members with scheduling appointments, connecting them with care programs, assisting them with prior authorizations, selecting a PCP 360, claims and provider billing support, and closing gaps in care. Members also have access to our CirrusMD telehealth service through our Moda 360 program. The CirrusMD app gives members the ability to text and chat with a provider discreetly at no cost to the member. Effective October 1st of 2022, members on a high-deductible health plan, which is medical plans 6 and 7, will be subject to the deductible with no member cost sharing after the deductible has been met. CirrusMD provides flexibility and convenience 24 hours a day, 7 days a week. CirrusMD providers can diagnose and also prescribe medication if needed. The program is available across the United States, which means they can text a doctor anytime, anywhere. To access CirrusMD, the member can log into their member dashboard or download the CirrusMD app on their mobile device. Members also have access to Meru Health, a digital application they can use to engage with behavioral health providers for the treatment of depression, burnout, and anxiety. Meru Health is a 12-week program that consists of daily chat support from a licensed therapist, a helpful wearable biofeedback device, anonymous peer and psychiatrist support, mindfulness practices, and habit-changing activities for sleep, nutrition, and more. Meru Health can be accessed anytime, anywhere, and is clinically proven to reduce stress, anxiety, and the symptoms of depression. The initial call is provided at the standard mental health cost-sharing amount. After that, the program is available at no out-of-pocket cost. Members can access Meru Health through their member dashboard or by downloading the Meru Health app on their mobile device. Livongo is an invitation-only program that combines the advanced technology of a smart glucose meter with health coaching to support members with type 2 diabetes. The program includes a smart glucose meter, unlimited testing strips, anytime access to expert health coaches, and can send alerts to their providers, family members, and coaches if the member allows this. Now, let's move on to vision. This slide provides an overview of the 3 vision plan options available. Members may choose to see any licensed ophthalmologist, optometrist, or optician, but will receive a discounted rate by going to an in-network participating provider. There are no changes to the vision benefit. Benefits will continue to run on a plan year basis from October 1st through September 30th. Each of these plans includes a benefit maximum, which applies to a vision exam and hardware. Next, we will review dental benefits. New this year, effective October 1st of 2022, OEB has added the Preventive First program. All preventive services, such as cleanings, will no longer accrue toward the annual benefit maximum. This means you will have additional dollars to use for basic and major services. There are no changes to the co-pays and co-insurances to the existing plan designs. We will continue to offer plans 1, 5, 6, and the exclusive PPO and the exclusive PPO incentive plan. The exclusive PPO and exclusive PPO incentive plan uses the PPO network. This means the plan does not include out-of-network benefit coverage. Members enrolled in either of these plans must see a Delta Dental PPO provider in order to receive benefits. This slide provides a side-by-side comparison of all of the Delta Dental plans. Delta Dental Plan 1 is an incentive-based benefit. This means the benefit increases by 10% each plan year to a maximum of 100% if the member visits the dentist at least once during the plan year. Failure to do so will cause a 10% reduction in benefits for the next plan year. But benefits will never fall below 70%. Dental Plan 5 includes incentive-based benefits for preventive and restorative services and constant benefits for major and prosthodontic services. Plan 6 is a constant benefit that does not include orthodontic coverage. Both exclusive PPO plans use the Delta Dental PPO network. With this plan, there are no out-of-network benefits, and members must see an in-network PPO provider. The exclusive PPO incentive plan has the highest benefit maximum of all of our plans at $2,300 per year. And, like Premier Plans 1 and 5, has incentive-based benefits on some services. Our traditional exclusive PPO plan is a constant benefit with a $1,500 plan year benefit maximum. Both exclusive PPO plans include orthodontic coverage. This slide highlights some of the great aspects of our Delta Dental plans. Plans 1, 5, and 6 use the Delta Dental Premier Network. Members get access to the largest network in Oregon with more than 2,200 providers, and nationwide with more than 154,000 providers. The Delta Dental PPO network has more than 1,200 providers in Oregon and more than 113,000 providers nationwide. Members enrolled in the exclusive PPO plans must use a Delta Dental PPO provider for benefits. There are no out-of-network benefits on these plans. At Delta Dental, we believe in an evidence-based approach to dentistry, placing an emphasis on preventive care. All dental plans include our Health Through Oral Wellness, or HTOW, program. This comprehensive, patient-centered wellness program helps members maintain optimal oral health through education, risk assessment, and evidence-based models of care. The program uses an oral health assessment to identify the member's risk of tooth decay, gum disease, and oral cancer. Based on the member's risk score, they may qualify for additional cleanings, fluoride treatments, sealants, and periodontal maintenance. Members can see which providers are currently participating in the HTOW program by looking for a green badge in Find Care. If they are not registered for HTOW, the provider can call our Health Through Oral Wellness provider line. Then our dedicated Health Through Oral Wellness team can help them register and even get in-person support. For more details on HTOW, members and providers can visit the websites shown here. Finally, let's review some of the resources available to you and your members. First, we want to remind you that we have a dedicated website just for OEB members, modahealth.com/OEB. Here, members can find more information and resources. These include access to their member dashboard, details about the programs within Moda 360, including Cirrus MD and Meru Health, additional information on wellness resources such as health coaching, behavioral health information, webinars, and cooking classes, and Find Care, our online provider directory. Through their member dashboard, OEB members can access tools, resources, and documents to help manage their benefits. These include claims and electronic copies of their explanation of benefits, or EOBs. Members can also download digital ID cards, start using their health coaching programs, and access tools such as the prescription price check or healthcare cost estimator. The member dashboard is also where members can go to choose a PCP 360 for each covered member in their family if they choose to participate in coordinated care. Members can access Moda 360 digital resources to manage their care through Cirrus MD, Livongo, and Meru Health. Additionally, members will be able to chat with a health navigator through their member dashboard. Find Care is Moda Health's online provider directory, where OEB members can look for their PCP 360 or other in-network medical, dental, and vision providers. Members will want to make sure they are choosing the correct network. Members looking to see if their primary care provider is a PCP 360 will look for the 360 icon badge shown here. Please keep in mind that the Moda Health account management team is here to help assist you in any way we can during open enrollment and throughout the year. We understand that this may be a lot of information to take in, So we would love to schedule a virtual or in-person meeting with you to discuss what we've covered and answer any questions. Please feel free to email us at oeb_marketing@modahealth.com at any time, and we will gladly set up a meeting. Thank you for watching.